All right. Hi, everyone. Welcome to Toya Talks. We are so excited today because we are welcoming back Lindsay Griffin, who is a licensed clinical social worker and a doctoral student at Bryn Mawr College. She has over 10 years of mental health experience, and she specializes in working with moms with perinatal mood disorders, so like depression, anxiety, different things that occur during pregnancy, right? As well as moms who are having any infertility struggles and challenges. Today, we're going to talk about an issue that affects a lot of women, which is infertility, as well as we're going to address endometriosis, because if you didn't realize, March is Endometriosis Awareness Month, and it does cause a lot of issues for women with fertility. And oftentimes they don't even realize that it is an issue. So we're excited to jump into this discussion, as well as addressing some of the controversial topics that have risen up in the news lately in regards to IVF, specifically around that Supreme Court ruling that came out of Alabama recently. Lindsay, did you have anything to add to your introduction? We're super excited you're here.
No, you covered the short part of it, so I think that's great.
Awesome. Now, I know, like I said, that you work with moms who have struggled with infertility in the past. And I know this comes from a very personal place, right? And you had your own challenge and journey with infertility. So would you mind just sharing a little bit with us about your journey with, infertility and how that connects with moms who are also facing these challenges?
Absolutely. So thanks again for having me on. I feel like this is such an important conversation to have. Especially like you said, this is Endometriosis Awareness Month. We have had a lot of things going on in the news related to infertility and IVF specifically. So to first start out with my journey. So I was diagnosed with endometriosis um, back in 2015. I had to like sit and think because the years are ticking on by now.
Mhm.
And I was diagnosed by a reproductive endocrinologist when I was actually trying to conceive. My husband and I had been trying to conceive for about 8 months around the time that I was diagnosed. And with that, we were told that the best option to conceive was going to be doing in vitro fertilization, IVF. So initially, as women do, very much hard on myself, was beating myself up about it. I was like concerned that my husband was going to leave me. He never said he was ever going to leave me, and all those kind of things that kind of come over you when it's like we're still relatively young. We look like we're healthy, but yet there's been this, disease going on inside where it's like ravaged my body to the point where I can't conceive on my own. And later on, as we get more into a discussion about endometriosis, I'll give a little bit more information around that. With the side note that I am not a medical provider, I am a social worker, but I'm speaking about these things from my personal experiences and the professional experiences with the clinical mental health services that I provide. I was very, very fortunate that we don't choose the bodies that we're born with. And it's like, it's not your fault that you have endometriosis or polycystic ovarian syndrome, PCOS, or
Mhm.
adenomyosis, or fibroids, or polyps. Like, nobody is doing anything with intentional knowledge that is producing these diseases and disorders of the reproductive system that's preventing them from getting pregnant. And so that's one thing I always talk to folks about. And they're like, yes, that's true. And I think a lot of times people, it helps to some extent, but it's also hard because so many of the folks that I work with are like, these are high achieving women. They're very career focused, what we consider like the traditional type A personality, organized, on point with things, and so used to having, this accomplishment mindset. Like, if I work hard enough for it, I'm going to get there and it's going to be worth my while.
Mhm.
And with infertility, it's something where it's completely out of your control.
Mhm.
And that's very hard to come to terms with. Hence why, with a lot of the work that I do, I really try to talk to folks about how, infertility can feel like a trauma, because with trauma, you don't feel like you're in control. It catches you by surprise. And it's also a loss, because a lot of times people have, envisioned what it would look like to, you know, find that perfect partner, grow their family, get pregnant, and that gets taken away once they're getting.
Truth is that, as you mentioned, this is something that's outside of your control.
Mhm.
And I think also recognizing too that infertility is an issue that affects a lot of women. The World Health Organization has actually recognized infertility as a public health issue.
Yes.
And here in the US, just for viewer knowledge, infertility, the definition is usually not being able to get pregnant after a year of trying, right? So here in the US, about 10% of women are between in reproductive ages, right? So between 15 or 44 have difficulty getting pregnant or staying pregnant. And 10% sounds maybe not huge, but that amounts to about 6.1 million women just here
Yep.
in the US.
Yes.
So, it's really important to understand also that, you're not alone.
Yes.
We're not alone, right? And so I think that helps to take a little bit of the pressure off. And as you mentioned before, we're not necessarily giving medical advice or anything like that, but just sharing these experiences and understanding that this isn't an isolated issue and that there are support groups, like you mentioned, that moms are able to reach out to that
Yep.
are going through, these challenges, or moms who are trying to be moms, that they can reach out to get support.
Yes. And just to elaborate a little bit more on what you brought up with the World Health Organization, again, as I talked about, there's female factor, but there are also times where there are male factor
Mhm.
infertility. And so globally, worldwide, the prevalence rate of infertility has gone up from what used to be 1 in 8. And now the World Health Organization, as of, I believe, 2023, has updated it. I can't remember if it's 2023 or 2022, but one of those, they updated it to 1 in 6. So globally, worldwide, 1 in 6 people are having some issues with their ability to procreate. And that is a vast number of people. And again, it just shows how much it impacts many people. And it's something that unfortunately so many people sit with very.
Perceptions that people have had about IVF or the infertility process?
So, very good question. And this relates to the specific area of work that I'm doing in my doctoral studies for my PhD in social work. Um, One of the things that I'm very focused on is reproductive health disparities and how they show up with particularly cisgender Black women. And Black women, unfortunately, are stereotyped to be hyperfertile, and many times both medical people and folks not in the medical field think that Black women do not have fertility issues, whereas the most recent data that shows fertility rates was a report in 2013 that shows that Black women are actually up to two times more likely to
Mhm.
have issues with conceiving compared to all other races.
Yes, and that's huge.
That
Like, I
is,
think we just need to pause there for a minute, right? Because I think that is a huge misconception that
yes,
Black women don't, deal with infertility. We should be able to easily get pregnant, but as you mentioned, 2 times more likely
yeah,
to have challenges with fertility. So I think that's really, really important, and that much more of a reason why, if you think that there may be an issue, see your provider and get it looked
absolutely.
into, because there could be an issue.
Absolutely. And with studies that I have read so far, those that have done qualitative work, so qualitative work, if you're familiar with research at all, is looking at more like the stories that people share about a particular topic that you're interested in. So there have been a very small handful of studies that are published within the past 10 years that have studied issues of infertility with Black women. And so often these participants are talking about like feelings of shame, feeling like they're outside the norm, feeling like they're supposed to be mothers. Like there's this one study that I cite very often in the work that I do where the participants talk about like alluding to like they're like I should be getting pregnant. I'm a Black woman because there's like this perceived Black fertility mandate. Like we're supposed to be able to have babies. If nothing
Mhm.
else, Black women should be able to have babies. And that's just not what reality is. It's a stereotype, it's a myth.
That's a great point. I hope that frees somebody today, right? Because, truly, we have to take that pressure off of ourselves. I think as Black women, we're already carrying a lot of pressure, and there are so many stereotypes. Um, I feel like that you have to constantly be aware of, and how you carry yourself and speak and all of the things. And then here on the reproductive side, there's all this pressure as well
Yeah.
to get pregnant, be able to be a mother, not have these fertility issues, and I think that also plays into that idea of, you know, Black women and Black people in general, right, being stronger, right? That idea that there's a higher pain tolerance, right, and
Yes.
things like that among Black people. And I think this is another one of those myths that play into that racial stereotype, right? So it's really important to be aware
Absolutely.
of that. I think that's great. Thank you for sharing. Were there any other myths that you could think of, or think
The
those are
other
your primary ones?
those are definitely my primary ones, but I think another thing that gets passed around in our society, I think sometimes it's meant as like a platitude or encouragement, but it doesn't land well at all. And I've heard it from many, many folks that I've met with individually and then also in the support groups that I facilitate, is when like people will just say, well, just relax, it'll happen. Well, just relax. It's like,
Mhm.
if relaxing was all you had to do to get pregnant, we would probably have like a billion more people in our global society. I can understand, and a lot of times I think about like folks that are sitting in these situations where they're hearing a person saying like, "Oh, I can't get pregnant. I've been trying to get pregnant," and it's like, don't you want to try to be like encouraging? But sometimes there's something to be said about just saying like, "I'm sorry to hear that you're going through
Mhm.
this. Is there anything that I could do to support you at this time?" At the very least, like even can offer a meal, doing
Right.
something like that does have some meaning. I know sometimes for some folks at different points in time in their journey, hearing folks say, well, what can I do? What can I do? When they're already emotionally like overwhelmed with the process can feel a lot. So sometimes just offering like, can I take you out to eat?
Yeah.
Can I get you
Yeah.
away for a little bit may actually land a lot better. And again, just trying to be acknowledge where people are at and saying like,
Right.
that sounds really hard. I'm sorry you're going through this.
I love that. And I really think that's an important point, because we're well meaning, and
Right.
sometimes without realizing it in our well meaningness, we can minimize people's feelings and people's experiences. And when
keep an eye on the ovaries and to see how the follicles, which are the sites where the eggs are developing during the course. So depending on how things are going, sometimes people are in there like almost every day. It might be every other day, but it's typically within like 7 to 10 days is how long that period of time takes. And then when they see that things are starting to look closer to maturity, they'll have you do some type of trigger injection, and then they have you scheduled for coming in to do an egg retrieval, and that's typically, you know, under some type of anesthesia. So you go under anesthesia, they use like their little transvaginal probe, and it also has like a needle attached to it, and they'll go in and like suction out those follicles that have the eggs. After that, um, typically while the woman is getting the egg retrieval done, the man may be, you know, somewhere in the building to give a sperm sample. Sometimes there are guys where they don't feel comfortable enough to be able to do it in the office that day. So sometimes they may walk in with it in the morning so that they can collect it at home. Or they may have where they do like a backup plan. So they'll have the male partner give a sperm sample like maybe a week or two before, that they'll freeze as a backup in the event that the male cannot produce a sperm sample that day. Because as we talk about, it's pressure.
Yeah, it is. Yeah, I'm sure.
It is pressure. So then once they've collected the eggs, they have the sperm in the lab. They have trained folks that are called embryologists that will then put the egg and the sperm together, whichever way their practice does. There's some practices that will inject a single sperm into an egg, and there are some times where they have a petri dish, they have the egg, and they put sperm on it, and then they come back and then kind of see what happens. So with IVF, and I think, and this is another misconception, people think that every egg retrieved is going to end up becoming an embryo. So a person goes in, they have 12 eggs retrieved, and they think, oh, I'm going to end up with 12 embryos. Not the case. Some of those eggs they may deem not to be mature. So it's like, hey, out of 12, you only had 10 that were mature, and out of the 10 that were mature, only 8 fertilized. And then they wait typically around like between 5 and 7 days, it seems like, is where most of the fertility clinics here in Delaware tend to monitor for. And they're waiting for the embryos to get to what they call a blastocyst stage. At that point in time, they're either bringing you back in for a fresh transfer where they have one embryo or multiple. Some places do multiple, and transfer back to the uterus, or they'll freeze them and hold them until it's time to do a transfer at a later date. So, but again, using that example, like, okay, you had 12, the only 10 were mature, 8 fertilized, and then they'll get to like day 5, and they're like, okay, out of that, you actually have 5 embryos that made it to blastocyst. And so with that, it's important to kind of acknowledge as well that there's just a lot of loss that comes along with the process of IVF, because sometimes folks will get excited saying like, oh, I had all these eggs retrieved. And then at the end of the week, they're sitting and they're like, oh man, I only have 2. And then there are some folks who will decide whether or not they want to do any type of pre-genetic screening for, you know, whatever personal reasons. Some people are like, we just want to make sure that we have a healthy embryo that goes in. Some have certain, you know, genetic factors that they're concerned about. And so they want to make sure that embryos that are transferred and possibly conceived don't have any of those type of like diseases. So with that, then it's like when those reports come back, then they have to kind of see and make a decision in terms of what they're actually able to work with.
Right. Yeah. So it's a lot more than I think people realize. Right. in terms of, like you said, it truly is a journey from the beginning of all the testing. Like you said, before you even start the process, you've got to go through all of the testing, and then
Yeah.
it's all of the medications, the injections, the frequent visits,
Yes.
the, egg collection, and just how much that takes on your body, the toll and the hormones that you're injecting, and what that does to your mood, and then your partner
Yeah.
who's supporting you in this process. These
Yeah.
partners, right? Like they're trying to deal, and be supportive to you and go through the process. So it's a lot. And I don't think everyone always realizes that. And then to your point, when you do finally have your embryos, there's still, the genetic testing and, the viability and all of the things that you mentioned. And I think it's important to highlight too with the genetic testing when you're thinking about viability of the pregnancy, because a lot of times miscarriages can occur because um,
Yes.
there was, a genetic, abnormality with the embryo that, maybe they didn't know or realize. So
Yes.
those are important factors to look into, as well. So I just really wanted to give, right, the viewers an overview that this is not like a process where you're walking in, they're taking an egg, a week later you're getting the baby in, or your embryo, and it really is
It's a process. As
process.
I said, it's a marathon, not a sprint. Like I said,
Yeah.
the year that I went through IVF initially, I want to say that I actually had started towards the end of February that year with like starting medications and all of this. And I did not have my first embryo transfer until June.
Oh wow. Yeah.
And I also had to have a surgery in between there because I have what's known as polyps, and these tissue growths that happen in the uterus, typically non-cancerous or anything like that. But from what my RE has said, it's like once you have them, you always get them back over a period of time.
Mhm.
And so because of that, I have had a lot of surgeries.
Yes.
And so it's like, okay, you have to get that removed before you have an embryo, transferred, because they don't want to have anything that could be blocking a site where it could potentially implant. So, yeah.
Right. Yeah, so that's another challenge. I'm glad you brought that up. Fibroids, even the endometrial tissue. I know of women who have gone through the IVF process who had to have surgery to get the endometrial tissue,
Yeah.
reduced or removed before they could implant. And then, like you mentioned, polyps. So even with the process, then there's still potentially surgeries that have to go into it.
surgeon is very, very skilled and was able to like excise these different places where it had attached to kind of help with the pain that I would feel
Mhm.
during the times that I had my menstrual cycle, but also to kind of help things be a little bit more towards normal for me to be able to carry a healthy pregnancy.
Yeah, and like you said, I mean, it's awesome that you did have access to, a great surgeon. And, as you mentioned, not everybody does have access to
Right.
the medical care or the, technology to be able to access this. And everyone who wants to be a parent, right,
Right.
should be able to, if they are experiencing challenges with infertility, they should be able to access, the care that they
Absolutely.
need, especially in this post Roe versus Wade world where things are
Yeah.
very
Yeah.
scary, right? And different than we've seen before, in our lifetimes, right? And from your perspective, right? And especially, post Roe versus Wade, and we briefly touched on this ruling that came out of Alabama, right?
Yeah.
What would you say about how the conversation has changed around infertility, especially lately?
So I appreciate this question because when Roe fell with the Dobbs decision, the very next day I was on my computer typing away. On my website, I do have a blog and I discuss my concerns as a mental health therapist that supports in a constitution, but people have the human right when they're born to make decisions over their bodies, whether they want to have children or not. And for those who do decide to become parents, they have the right to be able to parent their children in safe and healthy and sustainable environments, which is a whole other talking point in terms of like environmental justice, but environmental justice and reproductive justice are kind of like two sides of the same coin. And so the reproductive justice movement is real. It again, how we talked about like so much like infertility, pregnancy criminalization, even thinking about the ways that our maternal mortality rate is so high right now. Again, reproductive justice is saying that people should be able to have access to health care that they need. And especially when we're talking about reproduction, one of like the big organizations for reproductive justice across the states is called Sister Song. You can find them online. Another thing, especially talking more in the context of bringing it back to infertility, is looking at Resolve. Resolve is the National Infertility Awareness Association, and they have been doing a lot of work for many years related to advocating for like the fertility coverage mandates. Right now, as of May 2023, the last time I checked that there was an update, there are only 14 states in the United States that have these fertility coverage laws. And not a big surprise, a lot of the places that do have fertility coverage laws are also places that have things in place to protect abortion, whereas places that have been banning abortion have not been too quick on the uptake of having fertility mandate coverage. So those are a couple places that are definitely worth checking out. Another one that is specific for Black and Brown women who are experiencing infertility is the Broken Brown Egg. It's founded by Regina Townsend, and she has been a big advocate for Black women specifically on those having issues with infertility. And they have a Facebook group, and then they also have a website space that is a very safe space for Black women who are navigating issues of infertility.
Thank you so much for sharing those resources. So Sister Song, Resolve, Broken Brown Egg. I would definitely recommend you guys following if they have a subscriber list, and just keeping up to date with what they have going on. Also, as you're beginning to learn more, definitely writing letters, right, to your
Yes.
legislators is huge. If there are any maternal mortality awareness or infertility awareness things that you can get involved in, that would be great. I know here in Delaware, my organization hosts a maternal mortality walk, and we'll be doing it again in the fall of this year. And I think what's important about what you mentioned is that also those states that don't allow abortion, and have these really strict laws around pregnancy and viability and what you're able to do, those are also the states that have the highest levels of maternal mortality and morbidity, and that's not a coincidence.
No, not at all.
So especially when you're talking about getting involved, this shows what happens when we take away these reproductive freedoms. These states themselves are their own case study where we can see that when these protections are gone, it significantly impacts women and babies. I think those are all great ways for people to really stay informed and get involved. And again, just staying informed, I think, and you could probably attest to this, we get immersed in this work, but there are so many times when I talk to people that have no idea that maternal
Yeah.
mortality and morbidity is a thing, that have no idea that these infertility issues and what the impact of things like Roe versus Wade being rolled back and what the impact of these rulings in, Alabama and these different things, the Brittany Watts issue. I think that it's important that people stay connected and aware and understand what's going on, because the truth is that when we're not involved and we don't advocate, this is how these things end up
Yeah.
getting into place. And then we wake up one day, like, how did we get here?
Yes. And also being educated on the stances and positions of those that we are electing.
Yes. Yes,
So goes hand in
absolutely.
hand.
And again, so to the point of it being an election year, those are, all really important things that you understand where your elected officials stand. And that doesn't just go for the president, right? The major election, to be honest, it's actually that much more important that, your local legislators,
Yes.
you go out for these elections because they're the ones that will represent, your voice and the community's voice for where you live. So that's really, really awesome advice and guidance for our viewers to be able to take action. I really appreciate this time that we have here. And as we're getting ready to wrap up, I was just wondering if there were any last thoughts that you might want to share with anyone who may be struggling with infertility or know someone who's struggling with infertility. Is there, any resources that you'd want to share, as well as maybe a message of hope or support about the process? Because it can be really, really challenging
Yes.
and discouraging. So
For those who are going through the process of infertility, especially those going through the fertility treatment process, find out who your people are, your coping skills are. I always say, do not go through it alone.
yes.
So, like I said, there are online spaces. There may be support groups that you can get involved with. But also, if you're really, really, really finding that it's taking a toll on your mental health. You're having hard time getting up and getting to work. You don't want to hang out with your friends. Please seek an individual therapist that can really work with you on, creating a treatment plan and goals that you can work on individually. So that way you're not unsupported in the journey. For folks with loved ones, again, be kind. Don't ask folks when they're having babies. I want to get it on a shirt. Next month will be National Infertility Awareness Week at the end of April. I'm like, do not ask people when they having babies.
Mhm.
Because you never know. You may ask that to your friend and she may have just found out that the embryo transfer didn't work. Or you can ask another person and you can find out that they just had a pregnancy loss a couple of weeks ago. You don't know what people's situation is personally. And I honestly say stay out of people's bedrooms.
Mhm.
But if you're wanting to learn a little bit more about infertility and what it feels like, one book that I recommend to folks is Tanera Willis, Almost Barren, where she does give stories of folks who have, real life experience with infertility as a way to, at least develop a sense of sensitivity towards the subject.
Yeah, I think that's great. I like I said before, we put so much pressure on people. When are you going to get married? And then when are you going to have a baby? And to your point, especially that baby question, just don't ask, right? Give people space. And I think on the other end of that, for the person who is trying to get pregnant, it's okay to also have like a standard answer, right? That you just give
Yes,
something like, we'll get pregnant when the time is right for us, right?
yes,
So
yes,
that you're kind of shutting down the conversation, because those questions do come. But, for anybody who's listening, please don't ask. Allow people to go through their process when they're ready, because really you don't know what people's journeys are.
yep, exactly.
I want to just say this also as well in terms of getting support, with my organization, Mother, Baby, and Beyond. We primarily focus on postpartum support. And I know you and I will be doing another live during Black Maternal Health Week, where we'll
Yes,
get into some of the caregiver support that's needed, right? But I feel like it would be remiss for us to end this conversation without also talking about, in the infertility process, and this is a myth that I think I see on my end, is that a lot of women feel guilt, especially if they've gone through IVF and then they have their baby and they don't bond right away, or there
yes,
is postpartum depression, or
yes.
there is baby blues. And I have found that women who've gone through any fertility process actually beat themselves up that much more
Yeah.
because it's almost as though they feel like, I wanted this baby so bad and we went through so much. And now I have the baby and I'm not bonding, or I don't want to interact, and I'm, having all this depression. It's so important that in that postpartum period, please don't feel like because you went through this IVF and now you have this baby, you're supposed to magically be bonded. There's still a lot of mental challenges and processes and emotion that you have to go through. So just, I'm wondering if you could just speak a little to
Yeah.
that after you bring baby home and get all.
Yeah. And I appreciate that question because actually there are research studies out there that suggest that folks who have issues with infertility are actually at a slightly higher risk of developing a postpartum mood or anxiety disorder. And also, Black women are more likely to have issues with postpartum mental health in general. One thing I try to talk to folks about and saying, like, okay, the newborn stage is hard. There are some aspects that you're not getting sleep. Sometimes you're not eating well, and all of these things kind of goes back to what we had talked about in our first conversation about when people aren't having their needs met, it's going to just make it hard to function, period. But also, the thing is to remember when you bring home this little baby, even if you gestated the baby or if a person had to get like a gestational care, you're getting to know that little person.
Mm-hmm.
And it's fine if you don't feel like this magical connection the minute that you walk through the door with them. Actually, it's very, very normal to have that, even for folks who did not go through the fertility treatment process to have a baby. Like you said, I think there is this like shunning and shaming because it's like, I did all this work. I had to put out all this money. I had to get all these shots in my hiney. And then when the baby is there, like sometimes people almost have like a sense of like regret. And I always
Mm-hmm.
say that, emotions are these important, very important conversations. So, but I don't have anything left. So thank you again for having me again.
Yes, of course, of course. Thanks, Lindsay. And I'm sure we will be circling back to have another conversation in the future. So, everyone, thank you so much for taking the time just to be here with us today. As we said, please get involved in the reproductive justice movement. It's so very important. And as we said before, if you are a mom, a family working to get pregnant, please get the support and the resources that you need. And thank you all for your time. And I'll see you next time on Toya Talks. Bye.